Hello, my name is Tara Epstein, and I'm an RN working on a busy med-surg unit, and I see and face ethical issues every day. Today, I'll be discussing ethics in healthcare, specifically focusing on scientific communication, human research ethics, ethical issues in research communication, and effective communication with patients, families, and healthcare providers. These are essential to ensuring patient safety, informed decision-making, and professional integrity. The purpose of this presentation is to explore how ethical principles guide healthcare practices and to highlight the importance of clear, transparent communication in promoting trust and improving outcomes in healthcare settings. Principles of scientific communication. Scientific communication is the foundation of ethical and effective healthcare. It involves presenting research and medical information that is accurate, evidence-based, and transparent. Some key principles include clarity, information that should be presented in a way that is easy to understand for both professionals and the public. Accuracy. Data should be truthful and supported by reliable evidence. Misrepresentation can lead to misinformation and harm. Objectivity. Researchers must avoid bias and conflicts of interest when presenting findings. Confidentiality. Sensitive patient information should never be disclosed without consent. Ethical integrity. Information must be shared responsibly, avoiding exaggeration or omission of key details. Ethical implications in human research. When conducting human research, ethical principles must be followed to protect participants. Some key ethical considerations include informed consent. Participants must voluntarily agree to be part of a study after receiving complete information about risks, benefits, and their rights. Benefits and non-maleficence. Research should maximize benefits while minimizing potential harm. Justice. The selection of research participants should be fair, avoiding the exploitation of vulnerable populations. Confidentiality. Researchers must safeguard participants' personal health information. Ethical implications in human research. When conducting human research, ethical principles must be followed to protect participants. Some key ethical considerations include informed consent. Ethical issues in communication during research. Communication in research must be honest, respectful, and ethical. Ethical concerns include data misrepresentation. Altering or fabricating results can lead to false medical practices. Plagiarism. Using someone else's work without proper credit is unethical and damages credibility. Failure to disclose conflicts of interest. Must openly disclose financial or personal biases. Patient privacy violations. Sharing participant data without permission can lead to legal and ethical consequences. To uphold ethics, healthcare professionals should prioritize transparency, ensure accurate reporting, and respect patient privacy. Effective communication with patients, families, and healthcare providers. Effective communication in healthcare fosters trust, collaboration, and better patient outcomes. To communicate appropriately, With patients, use clear, non technical language, show empathy, and ensure informed consent. With families, be sensitive to their emotions, provide clear updates, and respect cultural differences. With healthcare providers, use concise and precise language, document findings accurately, and practice active listening. Therapeutic communication techniques such as open-ended questions and reflective listening helps build rapport and reduce misunderstandings. Writing formal correspondence in healthcare. Written communication is just as important as verbal communication in healthcare. When writing formal correspondence, such as emails, reports, or research papers, consider professional tone. Use respectful and neutral language. Conciseness. Keep messages direct and to the point. Clarity. Avoid jargon when communicating with non medical personnel. Proper formatting. Follow APA or institutional guidelines for research writing. Confidentiality. Protect patient data by avoiding unauthorized disclosures. Whether communicating with colleagues, patients, or the general public health, when communicating with colleagues, patients, or the public health, written communication should be professional, ethical, and clear. In conclusion, ethics in healthcare communication is essential for maintaining trust, protecting patients, and upholding professional integrity. By adhering to ethical principles in research, ensuring honest communication, and practicing effective written and verbal correspondence, we contribute to safer and more transparent healthcare practices. Thank you for your time, and I hope this presentation has provided valuable insights into the importance of ethical communication in healthcare. Any questions?